Hello, my name is Jonah Lopez, and this is my research review for the activity modification and knee strengthening of Osgood-Schlatter disease by Michael Rathliff. For my search strategy, I wanted to find out how exercise modification would affect adolescents with patellar tendon pain. It came up second in my search strategy, with the key terms being exercise and adolescence. Osgood-Schlatter disease affects the patellar tendon, which is why it also came up second. This is a prospective cohort study done by Michael S. Rathliff and colleagues conducted in Denmark. Now, Osgood-Schlatter's disease is a growth-related appendicitis of the knee, affecting 1 in 10 adolescents. Its prevalence is high in active adolescents, especially those in early sports specialization between 12 and 14 years old. It provides a fourfold greater risk. Osgood-Schlatter disease heals around 12 to 18 months. However, 60% of patients diagnosed with Osgood-Schlatter disease within 6 months report knee pain still. Continued pain is associated with impairments of both the knee and quality of life. Even after resolving the pain, patients still suffer with large deficits of strength and function. This leads to the research question: what is the effect of an intervention consisting of education on activity modification and knee strengthening exercises designed for adolescents with Osgood-Schlatter disease? High-degree sport and repetitive overuse are critical in developing Osgood-Schlatter disease. These findings can provide key treatment targets that have never been investigated before. Participants were recruited from 2015 to 2017 via local schools and social media across the North Denmark region. Intervention included 4 visits to the physical therapist over a 12-week period with a parent. From 0 to 4 weeks, and consisted of a temporary reduction in sport participation, abstaining from pain-aggravating activities, and they were instructed to perform knee strengthening in the form of static holds and bridges in order to maintain knee strength. From 5 to 12 weeks, adolescents were instructed to perform a progressive home-based knee strengthening program in the form of an activity ladder that was given to them. The activity ladder that was in the pain monitoring model enabled participants to progress exercises and activities in 3 levels between visits to the physical therapist. Now, patients reported high rates of self-reported outcomes, 80% in 12 weeks, and the intervention would increase the knee strength and function to the same of those without Osgood-Schlatter disease. But less than 50% of patients at 12 months followed up stated that they would be satisfied to live with current symptoms. This suggests that even though the pain was better than before, it still had a negative impact on their quality of life. And as sports participation can really have an impact on your quality of life, such as your mental health and your physical health as well. After 3 months at the end of the study, 16% of patients returned to sport. At 12 months, 69% of patients returned to sport. The intervention may have actually delayed the return to sport due to the requirements placed on them by the activity ladder. The contradiction that many adolescents stated that they felt the knee pain had much improved, yet could not return to sport, needs further research to disentangle. The intervention may have an improvement on the knee strengthening and function. There was still a delay in returning to sport participation, signifying the importance of balancing structured rehabilitation protocols rather than soloing only activity modification and knee strengthening exercises. The activity ladder incorporated in the study can be used by clinicians as a stepwise approach to reintroduce a physical activity, helping adolescents avoid flare-ups and build tolerance, sort of like a vaccine. The integration of home-based activity modification and knee strengthening exercises can provide practical and accessible programs used for schools, clinics, and other programs that are cost-effective and equipment effective as well. It can be used as an emphasis on pain-guided rehabilitation. Progression of pain is based on pain levels rather than strict timelines to promote individualized rehab and reduce risk of overloading the knee either too quickly or too late. It helps set realistic expectations for parents, coaches, and themselves about the recovery timeline and the set symptom control and balance between passive and active recovery. Now, the limitations is that this was a non-controlled study. which can result in high selection bias in adolescents. It also can release a confounding in the experiment that can influence the outcome either positively or negatively. Adolescents that were suffering knee pain pre-baseline study over a long period have shown to have a decreased quick natural resolution or healing. The study included two functional tests, jump for height and jump for distance. However, the reliability of these two tests is unknown. It's unclear if adolescents with continued knee pain at 12 months checkup still had Osgood-Schlatter related to knee pain, or if they reported any additional pain as well. Thanks for listening. I hope you enjoyed.